So a lot of them spend everything they have just to be able to cross over. Then once they're in Cairo, this family in particular only had 4 days worth of rent at the hotel that they were staying at, and you see where they were and what happened to them and where they are now, and where they feel like they're gonna go next. It's a whole level of tawakkul. So now she has an elderly mother and she has a sister. Now you have a choice. Who do I take with me?
بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على سيدنا محمد وعلى آله وأصحابه ومن اهتدى بهديه واستنى بسنته إلى يوم الدين أما بعد. Welcome everybody to Project Ihya Podcast. Alhamdulillah, today we have with us an important guest, Dr. Usama Khalid. Dr. Saab, welcome to the program.
Jazakumullah khair. Assalamu alaikum.
Welcome.
So Alhamdulillah, as everybody is probably aware of, that we've done several programs and we've done several podcasts pertaining to Gaza and the situation that's happening right now in Palestine, primarily because it is more than just a political issue for us. It's something that is really religious, and every Muslim, their heart and their mind is kind of always attached to what's going on, and there have been multiple rounds of flare-ups, we can say, and right now we have what's going on in Rafah, and that's the latest sort of flare-up. So we like to keep everybody informed of what's happening and also discuss what's happening there. And recently we had Dr. Mateen with us, who actually visited Gaza. That was before this recent round of what happened there. And Alhamdulillah, now we have Dr. Usama Khaled with us on the podcast, and he actually recently took a trip over to Gaza as well. Dr. Usama Khaled, for those who don't know, is a resident here. He lives around us, mashallah. He's a good friend of ours. He's a part of Project Ihya as a supporter, and he's a regular with us. And mashallah, he graduated. He got his medical degree from Wayne State University in Detroit. And mashallah, he's also a hafiz of the Quran, and he's currently working in Emory University Hospital, correct?
Johns Creek.
Johns Creek. So alhamdulillah, he recently took a trip to try to get into Gaza, and inshallah we're going to have a conversation with him about his experience and his journey. So I guess before we get into all the details, we wanted to ask, as we did even with our last guest, that how does the opportunity come up? A lot of people don't really understand how anybody is getting in or anybody is getting out, and it's kind of an obscure process for most people. So how, inshallah, if you could shed some light on how the opportunity came about for you.
So the concept of traveling and doing medical mission trips is something that's pretty familiar to people do it during medical school, during residency, less during residency, and then afterwards as well. So once this started, the need for healthcare and for the need for healthcare workers to go there and do what they can, that was a huge, it was like a burning desire and a realization that is something that we can offer, and that is something that we can give. So it started with just searching for avenues, and then you start to come across people. I came across Dr. Mateen himself. I know he had gone. One of my other close friends, Dr. Jawad from California, he had also just came back, so I was in contact with him, and just kind of filling out forms for a lot of these relief organizations and medical mission organizations, and just seeing where we can get in and what way we can go in.
And it's something that I didn't even mention in the opening, is that you are a ER doctor, like you deal with emergency cases. Mm-hmm. So this seemed like this would be kind of a no-brainer in your mind, knowing that this is kind of, where your expertise is. But yeah, Musab, you wanted to?
Yeah, I was going to say that, is this something any doctor can do? Any doctor can apply for?
Yeah, yeah. So if you go on the websites of all of these different organizations, whether it's Doctors Without Borders or some of the well-known ones are Med Global, Doctors Without Borders. I went with Humanity Auxilium, which is also a pretty large organization that's been doing work in a lot of different fronts in South Asia and then now in Gaza as well. They're very involved. Fajr Scientific is another one of these. So you can go on their website and sign up as a volunteer, and they ask you what specialty you are, and you specify that, and based on that, a lot of times they will triage and see what they need there.
Wow. And what's the minimum requirements? Like, could you be like a resident? Like, if you've passed medical school and you want to go now, would that work? Or do you need to be like done with residency?
So not necessarily. They whatever capacity you put in under your occupation. If you say you're a nurse or you're a physician or if you're a medical student, the licensing varies for them, but a lot of them have the capacity to take multiple different people and types of
You actually don't even have to be a doctor to go.
mhm.
Even medical students can go.
Yes, medical students, nurses. I mean, one of the groups that went at the same time as us, they had ER nurses with them. One group had a midwife with them that went to,
Wow.
I think, Emirati Hospital. That's where they have the
Mhm.
OBGYN care. So
Other than someone in the healthcare field, is there any other profession that is allowed to go in for any other reason?
through the medical mission organizations, I think it's
No.
limited,
Yeah, of
but
course not from those. Like, are there any
mhm,
other organizations? Like, I think, for example, there was the World, what was it? The World something Kitchen, right?
World Food Kitchen.
World Food Kitchen. So
Mhm.
that's another organization which is non-medical. Are there other? Do you know of any other organization?
Yeah, so there are other organizations. There's some search and rescue organizations that can go in. What avenues they can get in and their schedule and requirements are different.
No.
But part of the convoy that was going in with us, there were some search and rescue organizations from Denmark that were going in with us as well.
Wow, that's pretty cool.
That's good to know because I know a lot of people they might be thinking that it's only doctors, but other people also have the capacity to
Mhm.
make it in. Aside from journalists, I think they don't let journalists in.
Hmm.
Yeah,
Uh,
they've limited that, but there's a lot more red tape around non-medical organizations. So you have
mm,
to. It's not as easy. Yeah.
So how was the decision making process? Like, when the opportunity presented itself, what went through your mind, and how was that?
I mean, after the initial shock, like weeks of just following social media, seeing all of the different, you know, um, videos and clips and reels of people getting injured, it was just a period of desperation, right? And then after that period of despair, started to go into starting to help in whatever way we can, right? And it was a lot of deep conversations with family about what is it that we can do, right? For those who can make dua, they make dua. For those who can make dua and give help financially, there is a little mental obstacle there to make sure that we're helping the right people financially, right?
Mm.
Um, but everyone did what they could, and then beyond that, for those who, for me personally, I felt like this is what I trained for, right? Like it's fine, I work and I get paid, and that's beautiful in its own way. But this is what I need to do, right? So that was kind of the main driving force behind looking for this opportunity.
It was like a sense of duty, like I've done
It
this.
was, yeah,
Inshallah.
absolutely,
he had been
And
summoned
yeah,
in a
yeah.
sense.
And that feeling was, I considered it. That's what I told my wife as well. Is that that feeling's a guest in your heart,
Mm.
and proper entertainment of that guest is that you follow through with it. You
How
know.
easy was the family buy-in?
Um,
Because I can't imagine I think that's probably more difficult for more people than you know
yeah,
personal decision itself.
yeah. That was, Alhamdulillah. There was support. There was a lot of comforting needed and a lot of um, just kind of open conversations about what it entails and what are the possibilities. With wife, with the kids, as well. But alhamdulillah, like one of the moments of clarity and that helped me solidify it my need to go and my decision to go for both my wife and I was, my 6-year-old daughter, as they were asking, they're like, what if you go there and what if you die, you know, and having the conversation that the time of death, the time and mode of death is already written for us. And,
Mm.
we are, uh, Allahumma salli ala Muhammad, wherever that's going to happen, whether I'm here, whether I'm over there, you know, it will happen. And, excuse me one second.
Yeah, subhanallah, that's one thing that a Muslim has, is we
Yeah,
have a further vision, and sort of our theology helps us in those difficult conversations. And it's actually something that was exposed, the world was exposed to when they saw what was happening in the people in Palestine, and they showed incredible resilience,
hmm,
even saying Alhamdulillah after. I mean, I just saw a clip this morning where a man was holding his baby who had just been killed, and it was written that this was his last child that was still alive, and Allah Subhanahu wa Taala took even this last child from him, and he was just saying Alhamdulillah, and this is kind of like mind-boggling to people.
yeah,
And only Islam, or only Deen, or only firm conviction can bring about that kind of perseverance and that kind of sort of mental fortitude and strength.
yeah,
So, and it shows that it's even it's not just for when people are in that situation, but it kicks in even when we as Muslims have to think about the little things that we can do from our
yeah.
side. But that kind of leads into another question. You find a lot of even non-Muslim doctors and nurses, and that do sign up to go over to these areas. Would you be able to shed any light on what's their thinking process? What's their sort of, is it just, are they driven by moral duty, or how does?
Yeah, they are. It's actually beautiful. One of my colleagues that works at one of the hospitals in Emory, she went with Doctors Without Borders immediately after the initial attack happened,
Mm,
and basically I think early November is when we got an email saying that she suddenly got summoned to go and she's looking for coverage for all of her shifts. And all of our colleagues, Muslim, non-Muslim, everybody stepped in, covered all of her shifts within a couple of days. All of
mm,
her shifts were covered, and she went for 2 weeks and came back. That was actually the first time where I was like, "Huh, if
yeah,
if people are going like this, what
yeah,
who am I? Who am I and what am I doing? It's a real look at myself." But yeah, a lot of them they have this sense of selflessness and of just doing the right thing, what they felt was the right thing.
subhanallah. It's
Yeah,
that fitra, Allah subhanahu wa ta'ala puts inside of people.
yeah,
And I imagine like when a person makes the decision to go, you have to go through a process of like detachment, like detaching yourself from, like you suddenly realize how many attachments you have, and it must be like some deep introspection also.
yeah. A lot of that, whether it's understanding of self or kind of desensitization, so to speak, where you're able to detach yourself from your emotions. A lot of that comes pretty naturally to the profession as well, especially to the high trauma type of specialties, right? Because you see so much death, you see so many people suffering, and you meet people at their emotional, physical, mental lowest points. That these concepts of having to separate yourself from your emotion and need for that to be able to function even within your regular job, that becomes second nature to a lot of people working, whether it's in the ER or in trauma surgery or any of these high trauma, high adrenaline type of specialties. Um,
Um, I want to ask you something that I asked Dr. Mateen, and actually the reason I asked him was something you had told me once. So I remember you had mentioned one time, like we were talking. It was a few years ago, and you mentioned how a doctor gets like desensitized, right? You stop like to some degree it gets normalized. So did you feel the images that you saw from Gaza and all those, did you feel that that was like at a much higher level? Or I was going to ask you actually, uh, based on the situation, but I just remembered you, of course you weren't able to get in. So,
mhm.
but the people that you met in Egypt, right? Or the images that you saw, like how did you process those?
And I think Dr. Mateen, he also said that it's less desensitization and more, what is it, compartmentalization. You have to just kind of like compartmentalize sort of your emotions and things like that.
Mhm. Yeah, so to be able to separate yourself from the social and just that aspect of the human being that you're seeing in front of them. It's different looking at the images from Gaza or from other other conflicts, but especially from Gaza. It's different looking at those images because of the context, right? When you're at work, when you're in that frame of mind, it's easier to separate yourself. But when you're looking at it from as a father, I'm not looking at it as an ER doctor in that moment. I'm not looking at it as the trauma surgeon in that moment. So it hurts very different. It hurts in a very real sense, because you're looking at it from a perspective of all the different familial social contexts that you're seeing the post from, right? And even being so once you're there though, a lot of my colleagues who had been there and they will come back. Once you're in that frame of mind, you're wearing that thinking cap. It's you're back to your professional self, where you're as hard as it is, you're focused on what needs to be done, and you're able to separate yourself from that and do what needs to be done instead of reveling in the emotional aspects of it.
That's one of the fascinating things about human beings is that, you know, how we think is all, it just shows how much of it is influenced by our context that we're in.
Yeah.
Sometimes you just have to put yourself in that position, and you don't really know how you would react or how you would do or whether you'd shine or not until you actually put yourself. And that's sort of a lesson that I think a lot of people can take from that idea itself, that you have to take action and put yourself in those shoes and in that context and see, then you can really see how you would actually perform.
Yeah. Either you're succeeding or you're learning. Like there's no loss in this situation, right? Like you're every moment that you feel like you didn't come through the way you could have.
Mhm.
That's kind of what residency is, right? Is those 3 years of just concentrated drilling, and they call you a resident because you're pretty much living at the hospital, going through these experiences over and over. The first time you see blood, it creates a reaction, right? But then you keep seeing it, keep going through it, these same experiences until you get used to doing what you need to do for the best outcome.
No. So let's talk about the process of the process with the organization. How was the process like once you submitted your paperwork or whatever? Like, how was the process um, until you got approved?
Yeah, so the process was pretty straightforward. Once I filled the online form, someone from the organization reached out to me, asked me some questions like a basic interview about what do I do, where do I live, how did I find out about them. I told them about my contact who had gone through Humanity Auxilium as well, Dr. Jawad, and and then from there it's basically just sending them your passport, your medical license to kind of verify that information, and then they put you on their roster. They add you to the WhatsApp group or the communication group that they're using, and yeah, that's pretty much it. Then you start to decide on what dates you can go, what dates the missions are going, and that's where we with the urgency that was happening with the WHO, the World Health Organization at that time was sending very frequent groups. So every 2 weeks there was a group going, from per organization. Actually, almost every 10 days, they had a group going. So yeah, I would
Is the
say that
maximum like you can go for is that 2 weeks, or do they actually have a longer?
they have a minimum duration. So we'll get into like the policies around border crossing through Rafah, but uh, what the World Health Organization basically communicates with the governments that are involved, and in this case, it was the Israeli government and the Egyptian government crossing over from Rafah, and they set a minimum length that you can go for. And for them at that time when I signed up, it was 10 days, so you could
Mm.
go for a minimum of 10 days. You couldn't come back any earlier. And then if you're once you're there, and if you want to stay for longer, that was a whole separate application process. So then you apply at least 7 days before your date that you're scheduled to leave, to be extended more. And there were most of the organizations were not they weren't too supportive of that because it took a lot of extra paperwork in
Mhm.
in addition to just their usual system that they had going.
Is there the specific reason why you chose the organization you did, as opposed to one of the others?
Just because my friend went with it,
Oh, okay.
he had good things to say about it, and then looking at the people that were running the organization, I was familiar with their background. A couple of the lead physician, Dr. Fozia Alvi, she's from Pakistan as well, and
Mm.
a lot of the team on there, I was able to recognize where they're from. So there was a familiarity about it, really, and that was it. I actually filled out the form for other organizations as well, but they were the first ones to get back to me,
Mm.
so I basically stuck with them. Yeah, I just wanted to get in. I don't care who I go with.
Yeah. No, the reason I asked is because I know eventually you weren't able to get in, uh,
Hmm.
and it was kind of tied into the organization itself.
Yeah, it was tied into one of their partner organizations.
Oh, okay.
So, Hafizah, when the date finally came, can you walk us chronologically, through the series of events that followed?
Sure. So, Allahumma salli ala Muhammad. Yeah, so I was actually going. I kind of didn't finish my thought earlier. My daughter, once I told her about the time of death and place of death, like her first response was that if you are written to die during these next 2 weeks, I'd rather you do it there, helping the people of Gaza, than die at home.
Mm.
And,
Uh-huh.
and so that perspective was huge. But Alhamdulillah, we went through the application process, and
And that must have really gave you a lot of courage too,
a
innit?
lot, yeah, a lot of encouragement, a lot of, man, if a child is able to piece that together, then
Yeah.
everything else I'm feeling on top of that is just fluff.
Yeah.
Um,
Also, did you tell your whole family, like extended family, or like what level did you kind of stop at?
so
Because like
once
that.
I
Mm.
yeah, so after making mashra with the people that were the people of Muamala, that once I made mashra with them and decided, then I signed up, and then after signing up, I let the rest of my family know. My parents, my siblings, my in-laws, we let them all know and came up with a plan to how we were going to make it happen, inshallah.
Yeah, I think the biggest difficulty is the immediate,
Yeah.
wife, kids, and things like that.
Yeah,
Well,
yeah, yeah. My parents had a little bit of actually, my father had a little hesitation about the decision to go, but after talking, and then my mother encouraged him as well and talked to him about it. So alhamdulillah, it became easier from there. A lot of dua as well, of course.
alhamdulillah.
Yeah, usually the father, I mean, like you grow up breaking the rules, so they're used to just, all right, he's gonna break this one more rule.
Yeah,
Oh, it's good, mashallah, that you know it didn't become a hindrance.
alhamdulillah.
So yeah, so the day comes that you have to now head out.
Yes.
So how's that? What's going through your mind?
So what's going through at that point? You're just kind of focused on just what's the next step. Let's do this, right? So like there is a mental journey of like once the time comes close, then you start to feel the fear. You start to feel fear, and then you start to. And subhanallah, what's really interesting is I made the decision during Ramadan, and during Ramadan when I made the decision to go, I had no qualms about it. I had no issue with it. And the day after Eid, I have a deep sense of fear,
Mm.
like a deep sense of fear, and just wahsha just kind of sets in my heart. I'm like, like I could just help the people that are going. A lot, like a million different things is coming into my mind. And I actually addressed it with my wife. I was like, this is shaitan. This is what's from
Yeah,
shaitan.
wow.
This fear is coming from shaitan. Ramadan's over, and now suddenly I feel so differently than I did 2 days ago.
He was
What
unchained.
what changed? Exactly, exactly.
Jeeb.
And but a lot of istighfar, a lot of dua, and it just became after that mental journey of overcoming that fear, it just became a matter of focusing on what needs to be done. So I started to reach out to community, started to let select trustworthy people know that I'm going, in regards to taking some help to help people in Gaza, to help set up the organization with a clinic that they're working on setting up there locally as well. So yeah, after that it just became it almost turned into this uneasiness, and you could start to feel that your heart was just kind of traveling on its way to Gaza, and you're just trying to follow it where it goes. But yeah, and then as the time came closer, to go. I went, took my family, dropped them off with my in-laws to kind of help with the kids and everything. And then from there, Alhamdulillah, the safar started. The journey started to Cairo, and then incidents happened that we'll talk about as far as why I couldn't
Did you
get
go
in.
in a group from here, or did you go alone?
I went by myself. We planned on joining in Cairo.
Okay.
So we were all part of one group text, and we were coordinating our travels. We had all arranged the same hotel, scheduled it ourselves, and then yeah, we were planning on joining up there, and then there were some required activities through the World Health Organization and the UN that we had to do before we crossed over into Rafah. So our arrival in Cairo was scheduled to be 2 days before our journey across the border. This was on We were supposed to cross over on April 29th. So we all ended up getting to Cairo on April 27th and joined up
Mm.
over there.
So then, after you reached Cairo, what were the next few days like?
So what we planned, so as we were traveling to Cairo,
Mm.
that is the day that we saw a text, a message stating that the organization Humanity Auxilium that I was signed up with, they
Mm.
had not yet reached this specific status called EMT status, which is a recognition from the World Health Organization to allow that organization to travel across the border and take a group by themselves across into Gaza. So
But
the
you
EM,
mentioned some of your friends before went with the same organization, right?
yeah, so that organization basically up until now they were working on getting the EMT status approved, and there were just one or two minor things that were pending before they got fully approved.
Mm.
So what would happen is this organization then partnered with another EMT organization, and basically everyone going with Humanity Auxilium would, once they got to Cairo, they would join up with their partner organization.
Okay, so they couldn't
That
do it independently.
they couldn't do it independently, so they partnered up with another organization that would basically apply for our approval to cross over. uh, that approval takes 7 days. So basically April 29th, so 7 days before that Monday,
Mm.
is when they submitted our names under that organization, which at that time that we were scheduled to go with was called Palestinian American Bridge.
Hmm.
And so they submitted our names under that, and then that approval goes to a number of different organizations. It goes from the WHO to the Egyptian government to there's a like a humanitarian branch of the IDF, the
Mm.
IOF, that called CAGOT, I believe. I don't
Kogat.
know. COGAT. COGAT,
Yeah.
yeah. So the approval comes from both sides before we're able to go in. So that got submitted the Monday before, and that's actually when we then bought our tickets. It
Mm.
was just 1 week before. We had to wait until that was submitted before we could purchase our tickets.
By
Uh,
the way, the expenses for the trip, who covers those? Is it the organization or each individual?
each individual. So different organizations have a different setup. Some will cover some of the expenses. For our trip, the ticket hotel was on us.
Hmm.
Okay.
Yeah,
So
and
you get to Egypt, you land in Egypt, and then you go in Cairo, you go to the hotel.
mhm.
So kind of just walk us through the.
So we land in Egypt. By the time we land in Egypt, we find out that the organization that we were going to cross over with, the EMT organization, they suspended uh, their missions for the foreseeable future.
The
Uh,
organization, or who's they?
the organization.
Okay.
So not Humanity Auxilium, but Palestinian American Bridge, the
Oh.
organization that was the EMT that was going to take us across. And some of the cited reasons were security concerns, because they were concerned about a ground invasion. They said their safe house that they were housing people at was along the proposed route for this
Mm.
organization. Um, Once we kind of looked more into it and saw that other organizations were still going in, there
Yeah.
was some more information that we found out as far as why they weren't able to go. I think there were a couple of minor compliance issues with some of the guidelines that were
Mm.
set. I think it was unintentional, but it just is what it is, and it's in such an uncertain situation. Um, things can go unplanned.
Yeah.
But
Yeah.
but yeah, so
Yeah.
that ended up happening. So that organization suspend there. So that's once we landed in Cairo, we found out that PAB is no longer taking groups. So now we're kind of stuck there thinking, so what do we do next? So then we talked to our leadership at Humanity Auxilium,
And
and there was
how many people were like in your group?
In our group through Humanity Auxilium, there were six of us.
So you
There were
guys were
six.
all kind of in the same hotel, maybe hanging out together.
Yeah, so three of us had already arrived, and the other three, yeah, the fourth one was arriving the following day, and then two people that hadn't flown out yet, they ended up canceling their trip because they saw the text before they left. So
Oh,
Mm.
they canceled their flights immediately. So four of us basically arrived in Cairo,
mm,
and yeah, once we arrived, we're kind of just sitting there going, okay, so what do we do now? And subhanallah, we the following day, so Sunday, Monday is when we were going in. Sunday we had a meeting, a security briefing with the WHO, and then also an in-person meeting that would kind of walk us through some of the resources that we have access to once we get there. So we decided we'll just go to those meetings and let's see what happens.
Yeah.
Maybe we can find somebody else to go. Maybe their PAB will be able to take us in, or Mary Auxilium will find a different carrier to take us in. So um, that was kind of, it is what it is. Alhamdulillah, ala kulli hal. And let's see what happens.
Was this your first time ever going to Cairo? Like,
Yeah, I'd
are you?
never been to Cairo before.
Okay.
wow. Subhanallah.
So yeah, so then Sunday we go to the WHO headquarters. SubhanAllah, before we went, we already had some things planned. So we had to pick up medical supplies. We had a list of medications that were needed. So we were kind of so Humanity Auxilium had a local liaison in uh, Gaza, who was the director at one of the hospitals there, and he was kind of letting us know what kind of medications are needed, what supplies are short, um, and so that's kind of Sunday morning that we kind of spent the day getting those necessary medications and supplies that would help us do our job uh, over there. We spent that day gathering those before we went over to the WHO headquarters. So we kind of
And you were
acted
able
as,
to take some supplies as well from the States, like an extra amount of, like with the bags and everything like that. You were able to take supplies from here as well.
yeah. So we were, there's a limit on how much book luggage we can take, but
Mhm.
we were able to gather some, some supplies that would essentially help us do. So we would ask our colleagues in their respective departments there
Mm.
what they needed and what we would need to function. And then we, it's kind of gathered some of those supplies and we were able to take that in with us, alhamdulillah. And then,
Musab, your mic is off.
Oh, so sorry. Couple questions. Number one, with the airlines, was there any recognition on their part? Like, did they give you extra baggage allowance or anything? And second question, what was the coordination like with your counterparts in Gaza?
so the airlines, some of them were allowing, I went with Turkish and, I had a third book luggage and they kind of let it slide.
Mm.
Um, and didn't charge me for it. And as far as coordination, it was all through our leadership at our organization. So we have one person that stays in contact with the local physician there, and then they would just kind of update the list of what we needed and needed to purchase while in Cairo or taking it from the U.S.
What was the thing that was in demand the most in terms of care that was needed?
SubhanAllah, everything, because
Yeah.
like they had, even something as simple as baby formula, like the eight trucks that are going, so many of them were blocked at the border uh, that very little, if anything, is going in, and the inflation and the price gouging within Gaza is
Mm.
so high because of the demand that people aren't able to purchase even the basic supplies. So, from a medical standpoint, what we were taking was just basic medications. It was just list of blood pressure medicine. So we had some colleagues on our team that were primary care physicians. We had a couple of surgeons, a couple of critical care people. So just medications, basic surgical supplies for the surgeons. For me, it was a lot of suture kits, kits to
Mm.
help sew up lacerations and stuff. Um, but yeah, that type of stuff. And it was continually varying. Like the list was continually being adjusted on a daily basis.
Yeah, that's what I imagined. That's why I asked, like, what was the thing that was basically something that you saw on every list? Uh,
Yeah,
but I guess it's hard to pinpoint something like that.
a lot of
Just
the common stuff was just medications.
mm.
IV medications, oral medications, Tylenol, Motrin. Like they didn't have pain meds, basic pain meds even.
And was there anything that was banned that you couldn't take with you?
Yeah, so basically, like narcotics, controlled substances were, I don't know if they were banned, but they were discouraged. And there's a lot of there's a lot of complexity with what sort of things you're able to take in, as far as what will just arc whether it's officially not allowed or not, doesn't change the fact that they'll give you a lot of trouble for
Yeah.
taking that in. Yeah.
So once you found out that we're not going to be able to go in, then how did you guys decide to use that time?
Yeah, so once we went to the meeting at the WHO headquarters, we met with the representative that was coordinating all of these entrances to just kind of go through the process of how that was going. So essentially, what they do is they were only opening. I'm going to use past tense now because that's not the case anymore.
Mm.
But as far as the Rafah border was concerned, Mondays and Wednesdays is when those are when any medical mission like organizations were able to cross the border, either going or coming back. And then to be approved and be on the list of the approved people on the convoy to enter or exit, you had to apply 7 days beforehand, and that would go through the approval process through all the uh, concerned parties, and then your name would be on the list for that day to cross over. So the organization, the WHO would basically submit your name, and then you would find out that you're on the list. And if you get taken off the list, like we did, so we found out Sunday that not only did our EMT organization suspend their missions, the all the names that were under them were now taken off the list. So now
Mm.
you're not in the approved list anymore. To restart the process, you have to start back over 7 days again. So that was like a major letdown at that moment, was finding out that we cannot enter. Like it's Monday right now, we can't enter on Wednesday, we can't enter in any way, shape, or form before next the following Monday if we submit our paperwork again tonight, right?
Oh,
And in order to be able to do that, now we have to find a different EMT, right? So not only do we as individuals that are now in Cairo, Humanity Auxilium has to find a new, because Humanity Auxilium has no problem sending people in. It's our carrier that wasn't able to take us in anymore.
Right.
So now they have to find a new EMT and have someone that's willing to take us on. So while I was there at the WHO headquarters, that's where I met this Dr. Musab, who was one of the lead physicians for Fajr Scientific. That's another organization that recently, we saw their interviews in the news as well.
Yeah, I
Um,
saw them do an interview. I think it was him with Piers Morgan.
yeah, he did an interview with Piers Moore. So I met
He
him
did it from
there.
inside of Rafah at that time.
Yeah, because they ended up getting stuck. So they ended up getting stuck there, and it was a process to get them out. But Allahumma salli ala Muhammad. Yeah, so I met him there because we were scheduled to go in at the same day, and
You would have been part of those stuck doctors,
mhm,
like a member of that team, huh?
yes, we would have been. So
Uh,
even if Humanity Auxilium had gotten in that first Monday, we
yeah.
would have been stuck there uh, when the border closed. But I met him there. We said "Assalamu alaikum" to each other and kind of got to know each other, introduced ourselves, and then I told him our situation. I said, there's six of us. We were with Humanity Auxilium. He knew the leadership at Humanity Auxilium personally.
Mm.
So he agreed. He said, okay, we're happy to take you on. We're going to have to resubmit your paperwork, but we can enter next Monday as soon as you're able to, inshallah. Now, uh, the couple of things there. One, they had to redo all the paperwork within a day because that night was the deadline, right?
Mm.
And then second thing, now I'm calling home and letting them know, hey, before I was going to leave on Monday and exit the following Wednesday and come
Yeah.
home. Now I'm leaving the following Monday, and the minimum is 10 days, but the WHO approved us to do for 1 week because of our situation. So basically, I'm now entering next Monday, and then I'm going to stay an extra 4 days. Then I'm coming back, right? So that was a little hard on the family,
Yeah.
because the kids had their mindset, oh, he's going to come home, and then here I am saying that I'm going to stay extra a few days. But alhamdulillah, they were supportive. They stood by me in that decision. And now that we're for sure going to be in Cairo for a week,
Yeah.
so what do we do here? So then alhamdulillah, we just started. we're like, it is what it is. قدر الله ما شاء فعل. And here we are. So let's try to see what we can do. And through some very amazing circumstances, we came across some people that were doing work with the refugees locally. And
What were
I
those circumstances, if you don't mind?
yeah, yeah, it was fascinating, man. As we were going in, as I was traveling to Cairo, I communicated with one physician that was in Cairo, and she wasn't able to go into Gaza because of the timings of her trip that she could go in. There were no trips going at that time, so she was staying in Cairo and made some contacts there, and was just kind of helping families here and there. Going and seeing them, doing home visits at the refugees' houses, at their living spaces. So once we found out that we couldn't go, I reached out to her and I said, "Hey, we're going to be here for a week." And so she says, "Okay, let's meet and let's talk about what you guys can do, what I've been doing here, and see if there's some, you guys can continue that type of work." And she tells me I'm leaving tomorrow morning, so she's heading back to now. This is Monday evening is when we reach out to her, and she tells us that I'm Tuesday morning I'm flying back to the States. I'm like, okay, so let's meet up. So we met up that night, and kind of talked about what she had been doing. She had been working with this group of people that were just in Cairo doing on their own dime, not a part of any organization, just kind of helping people.
Mm.
They had basically left their jobs in the U.S. and in Canada and in other countries as well, and we're just there helping people, Muslims, non-Muslims, all sorts of people there. Um,
Like refugees, or this was just general?
this was general people that just traveled to Cairo and were helping the
I'm
refugees.
saying the people they were helping, were they focused on
Yeah, yeah,
refugees or okay.
refugees. Refugees. So this is
They came,
most
these were people from the West or other countries that just came for this purpose to help the people in
just
Gaza.
for that purpose. Yeah, just through social media contacts and stuff like that, they were able to find uh, an avenue where they can you know find new people that are crossing over from the Rafah border. Families that are able to to afford to come over as refugees, and they would just kind of help them on their day to day needs. So she had been working. She had met up with them and was working with them. So subhanallah, you know we asked her if she could connect us with a couple of them, so that we can maybe go do the same types of home visits that she was doing. All of the people that came with her were actually going back around the same time as well.
Mm.
So that was it almost initially seemed like a bit of a dead end, but subhanallah, they that night when we had gone for the meeting, it was all over like a phone charger. So she needed a phone charger. Her phone was out of battery. I was like, "Oh, I have a portable charger. You can borrow mine."
Yeah.
So I gave her my phone charger, and we have the meeting. After the meeting, she goes back. She was staying far away in Cairo, and I realized that she took my charger with her. So I text her that night. I'm like, "Hey, you have my phone charger." She
Yeah.
goes, "Okay, I'm gonna drop it off with this person. Here's their number. Just pick it up from them because I'm flying out." SubhanAllah. And that person that I ended up going to meet became our biggest asset in coordinating care locally
Ah,
within
subhanallah.
Cairo. Yeah. So as I was going, so like that night, you're already kind of a little saddened by the fact that you can't go in, and then little obstacles here and there start to seem really big. And the next morning, when I was like, okay, I coordinated with that person. I'm like, hey, I have to pick up this charger. As I'm going, like just little moments of beauty that Allah allows you to see in those in such situations, right? Like that, just my Uber driver. So I sat in the car to go pick up my charger, and I feel like my whole morning is going to go to waste because I'm going across town just to do this little mundane task.
Yeah.
And my Uber driver, his name was Nasser, was such a beautiful individual. Like I sat down with him, we started talking. He started talking about Deen. He started talking about how his children wake him up for Fajr Salah, and there's four sons are al Hufaz, and just that connection that ended up being made was so comforting in its own beautiful way. Like I recognized it. I was like, man, Allah wanted us to meet.
Yeah.
Allah
Subhanallah.
wanted us to meet. So here I met based on this little thing, and then I go pick up the charger. I meet with that person, and that became a whole opportunity. And I asked her what she was doing in Cairo. We found out that she was still there helping people, and that became a huge avenue for us to continue working and working with people from Gaza. And then So yeah, subhanallah, a lot of little like moments of comfort from Allah subhanahu wa ta'ala.
Yeah, subhanallah. That's why it's important to network, and also, so you never know when one person can change the course of, forget a trip, your whole life. That happens also. Like
Yeah,
they say, "رُبَّ صُدْفَةٍ خَيْرٌ مِنْ أَلْفِ مِيعَادٍ." Sometimes one chance happening is better than 1,000 things that happen by appointment. So,
subhanallah.
Yeah,
That's so
so
true. That's so true.
Allah
so
subhanahu
the
wa
refugees you were tell us some of their stories if there is anyone that stands out, maybe you could.
Yeah, yeah. Subhanallah, every single one of their stories was heartbreaking and just had a very strange, like aspect of beauty to it
Mm.
as well. But
How many families or people did you meet, by the way, in the course of this week?
in the course of that week, I'd say about 20 that we were
Okay.
able to, as a group, we were able to. So I ended up basically coordinating visits with my colleagues as well. So we would, one of the things we were doing over the next week was just coming up with a schedule on who's going to go where for their visits, and they would just coordinate with the local volunteers and go and do their thing. So I would say about 15 to 20 families that we were able to see,
Mm.
alhamdulillah. And they were scattered all over Cairo, so it would be like 3 or 4 hours of driving every day just to kind of be able to see two or three families a day. Um, but even that first family that we saw, so this person that I met with over the phone charger, I asked to tag along. I was like, you do your first visit, let me come with you, and I'll see how it goes and what kind of needs they are and what their story is. So subhanallah, that night we went and met this family, husband and wife. They had a 1-year-old daughter, and the wife was 9 months pregnant with their second child. And she had had no prenatal care whatsoever. And we just kind of sat down, and I just kind of played, fly on the wall observer to see how it
Mm.
went. And there was a lot of comfort building, and there was a lot of like, needs assessment, but in a way that was um, this allowed them to speak at their own pace. So
Hmm.
it took a long time, a lot
Yeah.
longer than my ADD mind could handle, but but
You're patient.
alhamdulillah, yeah, that's right. But alhamdulillah, it was a beautiful experience, man. And so then I took some time in there to just to see what their process was to cross over, and subhanallah, the strife that they have to endure just to be able to cross over and be safe for their families. The company that there's only one company that has approval to allow people from Gaza to come to Cairo. It's a private company, um, and to be able to apply to cross over, you have to be someone has to apply on your behalf. So if I'm if you're someone in Gaza, someone has to apply on your behalf, and that person has to be a family member living in Cairo. So
Wow.
if you don't have even distant family, but if you don't have distant family members living in Cairo, they can't apply on your behalf.
Wow. So there's no chance if you don't have
There's
anyone in Cairo, that's it.
Yeah, but a lot of people do. They have distant cousins or relatives that are living. So, but adding red tape and obstacles and how smooth that process can be. There's only one office in all of Cairo for that company.
Mm.
There's a huge line, and then they only accept cash payments and like clean cash. And the at that time the rate to apply on behalf of your family members was about 5,000 US dollars per person, and 2,500 US dollars per child, just to be able to apply on their behalf.
So that
Um,
family of three is coming like it's about $12,500, huh?
yeah, well, so $12,500, but the processing time for that application is 3 weeks.
Hmm.
If you want to expedite it, it's an extra 1,000
Hmm.
per person. So they had to spend more than 12,500, close to $20,000 just to be able to be approved.
And
I
did
can
And
you
imagine it's not easy because they're also leaving behind family in Gaza, and
mhm,
so it's
yeah.
it's very, very psychologically a difficult decision to make.
Yes, yeah, absolutely. Some of their family members have passed. They have some remaining, and all of these people that are in Rafah now, so many of them were displaced from the north. So this family that I went and saw, the wife was a dentist, the husband was an engineer. So they're professionals, had a very comfortable life before all of this happened, and they would get a 5-minute forewarning to leave their home, and they would exit, and every single one of them would show you a video of their house being blown up right in front of their eyes. They're like, this is everything we owned, all gone right in front of our eyes.
Wow.
But so the application process would go through, and the way they find out that they can cross over is just one place in Rafah where they put the list of approved people to leave the following morning. So they put the list up at night, and you have to be there, look for your name on the list, and if you are on the list, you have to go get everything and be back by 7 a.m. at the spot where the bus picks you up. And the actual distance, it's like a 3-4 hour drive. For our convoy, the medical convoys to go across, it takes about 8 to 10 hours because of the checkpoints along the way. For these buses, like for this family particularly, it took them 30 hours
Wow.
to go from Rafah to Cairo. And then once they arrive in Cairo, I think from what I've understood, the only benefit they have is a governmental health insurance for a few months. Other than that, as far as living arrangements, daily expenses, everything is on their own. So a lot of them spend everything they have just to be able to cross over. Then once they're in Cairo, this family in particular only had 4 days worth of rent rent at the hotel that they were staying at, and that was all they had. Nothing after that.
How was the reception and the help from the local people in Egypt, and were they even aware? Like,
Yeah, so they know that that the Nazihin are coming, the displaced people are coming from Gaza, um, and they within their capacity, people are doing what they can. Whatever their internal feelings are, some of them, they're not really sure how the society will be able to handle them, how the economy will be able to handle them. So there's obviously they have their own qualms about it, they have their own reservations about it from that respect. But from a humanitarian standpoint, they try to do what they can. And whenever we tell them what we were there for, that most people were appreciative of it. Yeah.
mashallah.
Oh. So, so now you said the group had applied to get in the following week.
Hmm.
So what happens now? So you during this week you're visiting with refugees, and
Yeah. So during that week, some of the main things that we started to do, one was the visits with the refugees. Second was kind of finding organizations or just groups that were working locally and trying to network between them and collaborate. We didn't really have much time to do anything on our own,
Mm.
but just finding ways of just connecting dots. You know, I felt pretty comfortable like networking with people. My Arabic started to get more sharpened as I went along. I realized I was using less and less Google Translate, but alhamdulillah. So
Alhamdulillah.
it's
Egyptian Arabic.
yeah. I
You
started
were,
trying.
you were familiar with the Qatari dialect, right?
I'm familiar with Fusha.
You're familiar
Yeah.
with
Yeah, and then just a potpourri of different dialects.
Yeah, their
Yeah,
dialect, Egyptian dialect, is a bit difficult. It takes a bit to get used to it.
it does. Yeah, and then I would I
He'll
would
just
tell.
cycle through the dialects until he hits the right one, and they're like, oh,
I just tell them to slow down, and the way I tell them to slow down, they would have mercy on me and start speaking Fusha to me. So it would work out, alhamdulillah. But
no.
yeah,
But I know
so
Dr. Osama is pretty good at working things out. We actually I had the pleasure of doing Umrah with him, and mashallah, he can get around, on the street even. Mashallah.
yeah, it's that same ER mentality, man. When things are burning down, just make it work, and
Yeah.
it'll be fine,
Hmm.
alhamdulillah. But yeah, so we were able to kind of connect. There was an organization for Pakistan that's based in Pakistan that's starting to help families there. They've sponsored a few hundred families there, mashallah, helping them with their rent. But they had some needs that they weren't able to fulfill, some medical needs and that sort of stuff. We found another organization that, subhanallah, they started, and I met with them with complete like completely coincidental. It seemed like it's a coincidence, but there's no such thing as
Mm.
coincidence. SubhanAllah, it's like divinely orchestrated by Allah subhanahu wa ta'ala. But the way we came across them, and they became a huge help and a huge resource as well. But this group is called Network for Palestine, and subhanAllah, let me tell you first how I came across them. So now that we couldn't go anymore, right? And we're not sure if next Monday is going to go through because that deadline was the same day. We started finding ways of just giving the medications that we had, like boxes and boxes of medication, to like give it to people that were able to go. So one of our groups that was able to go, that actually Dr. Mateen went with as well, Gulia. Um, we met a couple of their volunteers by chance in the hotel lobby. We're like, hey, you guys look like you're going in. Like, what's your name? And they said we're going on Wednesday. So we were able to give them some medications. So the place where they were putting their supplies that they were taking personally for their use, um, that place was was kind of hosted by this person who had developed like a network for Palestinian refugees. And I met with her. She's originally from the U.S., I think, from Colorado, or I don't even remember, somewhere out west. And yeah, subhanAllah, like she lived in Cairo, had been living in Cairo for many years, um, and basically, by from through a family contact, she found out that a family had come over from Rafah, from Gaza actually, a few months ago, and she offered up her house to house them because they didn't have a place to stay. And that family had a lot of professionals in it, young people that graduated college, they had different skills, so they offered, hey, can we create a network that can help other refugee families that are coming, and we'll use our skills but your place. And that's how a partnership started. And subhanallah, this was in January. By May, when we were there, early May, they were already sponsoring about 1,000 families and
Subhanallah.
helping them with trying to just gather funds and help them with rent, help them adjust themselves to Cairo life. One of the things to note is people that are coming over, especially people in their 20s and 30s, they've never lived outside of Gaza.
Mm.
And Gaza was such a small silo. All of their brands are local. Everything is local because nothing can come in or out. So them coming to Cairo was a huge shock for them. Uh, as a, they were so alarmed at how big the streets were, how busy everything. Like it was a huge culture shock for them to come and see the big world. Almost like one of the people from there told me that like it seems like a huge world out here, and it's so overwhelming for us because we've
Oh,
spent our lives in Gaza in this small little area. Um,
Yeah, I think people don't realize like the psychological effect it has kind of living in a place that's organizations are calling like a concentration camp. And you coming
yeah.
out, it's kind of like this. You feel. I can't imagine. It's probably a bit scary.
Hmm.
It's
Yeah,
probably
so
a bit scary coming into such a
out
big.
of like
it's like stepping out of Plato's cave, like 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 some of the sentiments were very similar. Like you come out and everything is like, what is this? But subhanallah, man. So
Because in
so
Gaza, they would probably like know everybody on the street, that area. Everybody knows everyone to some degree.
yeah, if they tell you their family name and they tell you the area they're from, you can make a connection.
Yeah.
And even like their clothing brands and like everything is all locally started.
Mhm.
Most of it at least. So um but yeah, so these families, they were helping other families adjust, and whoever would come over, they would come in contact with. They would ask them, "What do you do for a living?" Like one of the people was a second year resident in orthopedic surgery, but he's a physician. So he joined on. He said, "Okay, I can contribute my skills. How am I going to do that?" He started networking with local hospitals, with local
Mm.
doctors' offices, and starting convincing them to give like insane amounts of discounts and medical services for free. So that's a whole network that got started. So alhamdulillah, like by connecting with this organization here, Network for Palestine, and then having met the organization from Pakistan as well. So I kind of connected them together. It's just kind of like networking with people. So um, alhamdulillah, we had a local contact from the community here as well who was very helpful because he had some connections. He had some friends in Egypt. So subhanAllah, they were all very helpful, and it almost, it was like an organized chaos where it
Yeah.
seemed like just a bunch of random things, and then
There's like a
slowly they
beauty
were
to
starting
it.
to come together. Yeah,
Yeah.
subhanAllah, man. And to be able to recognize that was very comforting
And
in
I think
those
that's one of the
uncertain
beauties
times.
of the Ummah as well, so diverse and everything, but there's something that unites and brings
Yeah,
everyone together. Subhanallah.
alhamdulillah.
I want to ask you, can you mention, like you mentioned, you met that couple, but can you mention some instances or some interactions that you had that maybe we can all take a lesson from, some things that stood out with your interactions with the people from Gaza specifically.
Allahumma salli ala Sayyidina Muhammad. So I I think that the main thing is just the uncertainty. That just the reality and the realization when you get to meet them personally, and you see where they were and what happened to them and where they are now, and where they feel like they're going to go next. It's a whole level of tawakkul, a whole
Mm,
level of tawakkul that you cannot fathom, but you sense it. They say the same words we say. They say the same du'as we say. They share the same ideas that we share based on Quran and Sunnah. But the ruh in their words, the spirit of their words affects you. Like it weighs on your heart. Subhanallah, like, uh, and just a psychological journey. Just a psychological journey. Them sharing their anecdotes. Like one person, for instance, she had a young son, married, has a young son. Um, Gets approved, but only gets approved for three people to cross over: herself, her child, and one other person. She can't take her husband. He didn't get approved. And whatever the approval process is, how stringent it is, what the I have no idea. They don't know. They say, you could have shared a post that they didn't like. They go through everything, right?
mm,
So you have no idea why they will or will not approve you. But so she has room for one other person, and now her sister and her mother's elderly. Her father passed away very soon, but very a little bit before this entire thing, conflict started, before the genocide started. And so now she has an elderly mother and she has a sister. Now you have a choice. Who do I take with me?
mm,
And just that, the pain and the internal conflict and the guilt that you have to endure, no matter what choice you make. With her mother ordered her and told her, no, take your younger sister, she has her whole life ahead of her, um, and I'll join you, inshallah. you know and but just the pain that you feel in the choices that they had to make, and then the gratitude you feel. I didn't choose to be me,
mm,
they didn't choose to be them. you know and there it feels like I'm in a better position than they are. But in the eyes of Allah subhanallah, who knows?
mm.
Allah knows.
I
And
think that was
and
a powerful thing you mentioned, that they say the same words we say,
yeah,
but it means something totally different. It's on another level. They say like Alhamdulillah or
yeah,
Allahu Akbar, but it doesn't. We say it. It's kind of just it stays on our tongue if it gets even down to our throat. But to them, it's really from the heart.
yeah.
SubhanAllah.
It's almost like, even in Ramadan, like you read Quran, and for the hufaz, like there's a point where when you've read enough Quran, because in Ramadan you read so much of it, there's a point where the words you are now suddenly reciting,
Mm,
it suddenly your heart starts to recite it,
yeah, so
because
true.
you recited it so much, and it's just purified, 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 and suddenly now your heart's saying it as well. You say, you say La ilaha illallah 1,000 times, maybe 997th time your heart will say La ilaha illallah. you
Mm,
know so that strife and that effort and that repetitive nature of, that it takes so long to penetrate our heart. These people, when they speak, they've been through so much that their hearts are speaking now.
mm,
All the emotion and all of the things that they're speaking, is all coming from their heart. So it feels very different. It
and
SubhanAllah.
feels very
was
different.
there like maybe a guilt that, hey, we made it out, and like, okay, you mentioned about the family members for sure, for that one family, but just in general, uh, there were so many more people. They all.
Yeah, it's a sense of survivor's guilt. But at the same time, the amount of gratitude that they have, and the amount of tawakkul that they had, that Allah chose us to exist. So it's all of that guilt gets channeled into just humbling gratitude in front of Allah subhanahu wa ta'ala.
Yeah, and the ulama will tell you that there's a level of iman. It's just basically a level of like rada bil qada, that you're pleased with whatever decision Allah Ta'ala has made, whatever circumstance that Allah Ta'ala put you in, you're pleased that if this is the decision of Allah Ta'ala, I'm okay with it. And that's actually a very difficult place to get to. But it's the difficulty of that journey is shortened, and the length of that journey is shortened when a person is put into these circumstances by Allah Ta'ala. So it's kind of like a, as difficult as it is to say it, sometimes these difficulties and the hardships, when they come to us, it's actually a, it's cloaked as a difficulty, but there's actually some khair in it. There's some good in it. Um, and I know if you only look at it from a worldly perspective, you would think that's, a crazy thing to say, that there's any good that one could, take out from the misery that they've been through. But as a Muslim, we see that positive, because the qada of Allah subhanahu wa ta'ala was that.
SubhanAllah, speaking to that point, I read recently, someone made this point that Maryam alayhi salatu wasalam, she said, Ya laytani mittu qabla hadha wa kuntu nasiyan mansiya. She was going through so much pain and tribulation because of the pain of childbirth, and also the mental pain because she knew what she was going to face when she went back. She's like, I wish I died before this. But hidden or cloaked within that pain, to use your words, was Maryam alayhi salatu wasalam, or it was Isa alayhi salatu wasalam, right? The Nabi of Allah subhanahu wa ta'ala. So he was saying the same thing, that okay, what looks like pain and difficulty to us, we don't know the aqiba, the end result of that. So may Allah subhanahu wa ta'ala, make this a means of, their freedom, and restore the affairs of the Muslims, and also return to Masjid Aqsa, inshallah.
Ameen.
So we're coming up over an hour. I want to ask you, so the time comes for you guys to go into Rafah now, the second time around, where your names have now been resubmitted and everything.
Yeah.
What happens now? So now you get onto the bus, you're getting ready, you're
Mm-hmm.
in that moment now.
So we're on Sunday again, and it's almost like a deja vu, right? So we're back at the WHO headquarters. I'm meeting with the same, coordinators, and they're congratulating me, like, "Hey, man, I'm glad you're able to go in. We're wearing different jackets now. We're wearing a different logo on our clothing. But so now we're going with Fajr Scientific, and alhamdulillah, I know we gathered. It was still 6 of us. The other 2 that weren't able to come, they found out that we got approved. We got their names on the list as well, so they ended up traveling, and they joined us in Cairo as well, alhamdulillah, that weekend. And that morning, subhanAllah, we gather at the WHO headquarters around 4 a.m. And the convoy leaves 5 a.m. sharp. So we all got together. We met with the other organizations. There were about 30 or 40 buses that were going together in the UN convoy. And we head out, alhamdulillah, we head out at 5 a.m. We're talking amongst each other, like, man, it finally happened. We used to say during the week, like, we won't believe it. We won't believe that we're going until we're actually on our way, until we're actually on our way there. So, we kind of sit down, we're ready to go. And then as we're driving 2 hours into the journey towards Rafah, now we're getting close to the first checkpoint, which is Ismailia. So we're getting close to the first Egyptian checkpoint, where they basically check our passports, checking everybody on the list, make sure everybody that's in the buses is on their approved list.
Before the Sinai or in the Sinai?
So Ismailia is the entrance into Sinai.
Okay.
So there's the first checkpoint before we enter into the Sinai is Ismailia, and then after that there's multiple checkpoints that come along the way, and then they do like spot checks of the luggage to see what's in it, that sort of stuff. But right before we're about to enter Ismailia, we get a message from the UN convoy leader that was, in the car leading all of us. He said, "Let's pull over at a gas station." So we pull over at a gas station, and he, tells all the team leaders to let's gather around. So I go and join the meeting, and basically that's when he tells us that we just got word from, from the occupation forces that they're starting their ground invasion today, and they will be closing down the border. So by the time we get there, the border will be closed. So they advised us to turn back.
That must have been a big bummer.
Yeah, there was, some people, everyone went through the stages of grief pretty quickly. There were some people angry, some people was in acceptance, some people in sorrow. But certain organizations, they called ahead. They said, no, it doesn't seem like it's, people are saying that it's still open right now, so we're going to keep going. So we went much amongst each other. Initially, I was inclined to just keep going, but then you would have to detach yourself from the WHO convoy, and that was not advisable.
Yeah.
But yeah, so they the convoy leader decided that we're going to turn back. So we made mashra. We talked to the leadership at Fajr Scientific as well, and they said if the WHO is saying turn back, just turn back. And subhanAllah, we all said a collective inna lillahi wa inna ilayhi raji'un, and with heavy hearts we turned back, and it was, I still feel that way. A part of my heart feels like it's missing, because that week spent in anticipation, it really felt like my heart went into Gaza with that first group on Monday, and that was what some of my conversations with my family as well about going the following Monday was. I just felt like I'm just going to retrieve my heart. That's part of the reason why I'm going there.
Subhanallah.
And yeah, so it was difficult, but Subhanallah, like once again, like Allah Subhanahu wa Taala, like little beautiful moments, right? Like little beautiful moments that happened. Like as soon as we got back in the car, the driver of our bus turned on some Quran, and the first thing that starts being recited in the Quran is إلا تنصروه فقد نصره الله إذ أخرجه الذين كفروا ثاني اثنين إذ هما في الغار إذ يقول لصاحبه لا تحزن إن الله معنا فأنزل الله سكينة. SubhanAllah,
Mm,
that ayah just meant something so different. I
yeah,
recited it thousands and thousands of times, but at that moment, this something about the ayah just was such a source of comfort. Well, alhamdulillah, alhamdulillah ala kulli
yeah.
hal. So yeah,
And there was khair in it. I mean, there was a lot of doctors that got stuck in Rafah and stuff that had just
yeah,
gone in right before you, and they went through a lot to try to get them out. I know a
yeah,
lot of doctors were that were being taken out of Rafah. They were, I saw a video of them. They were like weeping and stuff. They wanted to stay and help, but they were being moved out, forced out anyway.
yeah,
In a way, your decision was it was very difficult because it was more difficult than people who went in the past because you had the Rafah invasion looming the whole time. So you didn't know when you maybe when other people went in, they knew that it's happening in Gaza or North Gaza, but you actually had the possibility that it could happen while you're there. So subhanallah.
Allah
This,
subhanahu wa ta'ala reward you and give you the full reward. Your
yeah.
intentions were there, like you said, your heart was there.
I
And
mean,
inshallah, you will receive the reward. And Islam, we say, إِنَّمَا الْأَعْمَالُ بِالنِّيَّاتِ وَإِنَّمَا لِكُلِّ امْرِئٍ مَّا نَوَىٰ. You get what you intended. So Allah subhanahu wa ta'ala give you full reward, inshallah.
I mean,
And is there any last questions, Musab, if you have, before we?
you can ask if you have any last pieces of anything last final words to say before we wrap it up.
um, honestly, just being happy with the qada of Allah Subhanahu wa Taala.
Mhm.
Honestly, like that part, and equipping ourselves to be mentally, physically, spiritually ready to be who we were meant to be. To be there to serve the deen of Allah Subhanahu wa Taala. It's the niyyah, the effect of the niyyah and the strength of the niyyah is huge. And part of that is just being ready. So like I'm hoping inshallah that I can go back.
Uh,
Now the new route that they're trying is through Amman. So
mm,
some of the groups are going through Amman, crossing over. There are restrictions on them, obviously, because of the nature of their route, that they have to go through the occupied territories as well. There's a lot more restrictions on them, but inshallah,
inshallah. Allah
inshallah.
subhanahu wa ta'ala take us all there. Give us a chance to be in Aqsa as well
I mean, I
and
mean,
to uplift the ummah out of this terrible situation. Jazakumullah khair for your time.
yeah,
And we
inshallah,
appreciate you coming on. And inshallah, we hope to have you on again in the future as well.
inshallah.
Probably do a podcast in Aqsa when we all go, inshallah.
And that actually one of the things that I just wanted to mention, the
Yeah.
group that got stuck there, so I'm still a part of their group text,
Yeah.
the Fajr group, and they got delayed. And every day, they're like, we're running short on water. Their safe house was no longer safe. They all moved to the hospital, and just being a part of that journey and my heart wanting to be with them,
Yeah.
but seeing their strife and their conflict and how they got out. And subhanallah, the route they got out was through Amman. So they crossed over, because Rafah was still closed. They didn't exit through Rafah. They exit through the other side. And on the way to Amman, they were able to stay across the street from Al Aqsa.
Oh,
And
subhanallah.
they prayed in Al they prayed Jum'ah. They got there in time for Jum'ah. They prayed Jum'ah in Masjid Al Aqsa. They spent time in Masjid Al Aqsa. So like it's just the turn of events and how something beautiful came from it.
Inshallah, you
despite
get that
everything else.
reward as well because you were part of
Inshallah,
that group. So,
inshallah, inshallah. Jazakumullah
Jazakumullah
for
khair.
having me. Allah yabarak fikum.
Barakallah fi. Jazakumullah khair. Inshallah, we'll see everybody on our next podcast.
Allah.
Inshallah. Assalamu alaikum.
Salam.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum.